So for the last lecture of the semester, we're going to talk about urinary and reproductive tract diseases that are caused by microorganisms. These include UTIs, bacterial vaginosis, gonorrhea, chlamydia, syphilis, herpes, and human papillomavirus. For urinary tract infections, or UTIs, they can involve any portion of the urinary tract. E. coli is the most common cause, and the transmission is typically from the GI tract to the urinary tract of the same person. So from that person's anus to their urethra. For this reason, UTIs are more common in women than in men because the distance between the anus and the urethra is shorter in a woman than it is in a man. So women are more likely to get infected. Children and elderly patients are also more likely to get infected with UTIs. In elderly patients, if you've ever noticed that an elderly patient that you're working with or treating all of a sudden has dementia-like symptoms where they're forgetting things and getting confused and possibly have a fever, they may have a UTI. In elderly patients that have a weakened blood-brain barrier, the endotoxin that's released from E. coli can pass through from the blood into the brain and cause this dementia-like symptom. As soon as the UTI goes away and is successfully treated, the patient goes back to being normal and of normal cognition. So if a patient all of a sudden starts acting a little goofy and then gets better, then you may know why. Symptoms include pain in the pubic area, frequent urges to urinate when the bladder is empty, burning while urinating, and cloudy urine. This is treated successfully with antibiotics. Vaginitis versus vaginosis. Itis means inflammation, and when we have inflammation, there's redness, heat, swelling, and pain. So it's inflamed and really painful. Vaginosis means that there's an obvious infection, but you may not have all of the symptoms of, or the signs and symptoms of inflammation. So vaginitis is inflammation, vaginosis is simply an infection. Usually vaginitis is attributed to a yeast infection. So yeast cause all of those symptoms of inflammation. Well, vaginosis is usually attributed to Gardnerella vaginalis. And we'll talk about that on the next slide. So you have vaginal itching to some degree with both of these. Burning and sometimes a discharge occurs with both of these. And symptoms depend on the etiological agent. Bacterial vaginosis is largely attributed to Gardnerella vaginalis. So this infection is called vaginosis rather than vaginitis because inflammation in the vagina does not occur. Vaginal discharge with a very fishy odor, especially after sex. Why after sex? When a penis penetrates into the vagina, it opens up the vagina, exposing the fornix, which is where this bacteria tend to hide out. And that odor that has been kind of festering up in the fornix of the vagina can escape at that time. Itching is common, and this is treated with antibiotics, but you have to diagnose it first. And diagnosis is so tricky. And women that have chronic infections of the vagina always go in complaining of the same type of symptoms, and if they see any yeast present, they'll just say, oh, it's a yeast infection, here's fluconazole, and send them home. When really, it could be both a yeast infection and bacterial vaginosis caused by Gardnerella vaginalis. For diagnosis of this one, you have to look for clue cells, which means they're cells that are completely covered with the bacteria. You're also going to not want to see yeast present, which again, they could have a dual infection, but people don't really tend to pay attention to that. And then you would culture it. And culturing this one is so tricky because GVAG takes about 7 days and it only grows on chocolate agar. So it takes a really long time and you have to grow it in the presence of carbon dioxide. So it's difficult to grow. And then once you get the diagnosis, the patient has probably already gone through some type of treatment for a yeast infection. So by the time you confirm diagnosis, it's a little too late to start a new treatment. This one also cycles with hormonal changes. So as a woman who is premenopausal, kind of goes through all of the cycling, so between puberty and menopause where they have their monthly cycle, hormone levels will fluctuate, causing the flora of the vagina to change, and that can cause peaks of infection during some times of the month, and then the infection goes away. and then it comes back and returns, and it kind of comes in waves with symptoms. The best thing to do for treating bacterial vaginosis or any type of vaginal issues is to start consuming vitamin C. Vitamin C is ascorbic acid, so that's going to decrease the pH of the vagina. Another good thing to do is start taking probiotics. Now, the probiotics you take should not be the digestive tract probiotics. They should be specific for the vagina. You eat them through your digestive tract, but they have a way of making their way to the vagina. But you just have to make sure that the ones that you pick at the store actually say for vaginal microbiota. Gonorrhea. So gonorrhea is caused by Neisseria gonorrhoeae. It's known as the gonococcus. It's a gram-negative diplococci, so it's two little balls that look kind of bean-shaped right next to each other. It's a sexually transmitted disease, and it can transfer from mother to baby, particularly while the baby is going through the birth canal, but also in utero. It's treated with antibiotics. Symptoms of gonorrhea in a man include painful urination and a yellowish discharge, can occasionally spread from the urethra to the prostate gland and epididymis. Scar tissue in the spermatic ducts during healing can render a man infertile. Although this is rare, it's possible, especially nowadays when we have all of this antibiotic-resistant gonorrhea floating around. Patients take longer and longer to get treated with a successful antibiotic, which leads to an increase in the incidence of infertility. Female symptoms include mucopurulent or bloody vaginal discharge, painful urination if the urethra is affected, and this can spread and cause pelvic inflammatory disease, which is inflammation of multiple regions of the pelvis. In both sexes, this can also spread to the joints, and you can have gonorrhea joint infections, which is kind of crazy and random, but that can happen. Particularly with women, the scar tissue inside of, if it gets up to pelvic inflammatory disease and spreads to the fallopian tubes, scar tissue inside of the tubes can lead to ectopic pregnancy or tubal pregnancies. So as the fertilized embryo is trying to travel down the fallopian tube, scar tissue causes it to be trapped inside of the tube, and then as the baby starts to develop there, it will rupture the tube and pose a health risk to the mother as well. This is a required termination of the pregnancy, and the tube will, if it's not treated quickly enough, this could rupture the tube, rendering this side of the reproductive tract non-usable. So the chances of the woman getting pregnant are then 100% dependent on this side, this unaffected side. This is what it looks like when a baby is born with an eye infection with gonorrhea. Today in the United States, it is a requirement for the baby to be treated with antibiotic eye drops, in large part to prevent this from happening. Although the mother has an STD scan, there's no guarantee that the mom is not going to partake in sexual intercourse throughout the delivery or throughout the course of the pregnancy. So if the baby is born into an infective birth canal, they can get an infection in the eye, and it can cause permanent blindness. So blindness that's going to be with them for the rest of their lives. So now when the baby is born, we put this goopy stuff of antibiotic in their eyes to make sure that they don't go on to develop this gonorrhea or gonococcal blindness after birth. Even if it's a cesarean delivery, it's still commonly performed on babies to put that gunky stuff in their eyes. It's an antibiotic to prevent these types of infections. The next one is chlamydia. So chlamydia is caused by Chlamydia trachomatis. There's actually a lot of different types of chlamydia that exist, and they can cause respiratory infections, skin infections, eye infections. But the one we're going to focus on today is the sexually transmitted infection, so Chlamydia trachomatis. This one is very, very, very similar to gonorrhea. So on the exam, I will say, this is the causative agent of a sexually transmitted infection. The symptoms mimic those of gonorrhea. If you see in the question that I'm talking about it mimicking gonorrhea, I'm not talking about gonorrhea. I'm talking about the other one, the chlamydia. If you see a question where I say the symptoms mimic that of chlamydia, then I'm talking about gonorrhea. So just make a note of that to keep those straight on the exam. One of the major differences between chlamydia and gonorrhea is that Chlamydia trachomatis is an obligate intracellular parasite. Early researchers in chlamydia used to think that it was a virus, and they actually went as far as describing the hemagglutinin and neuraminidase groups of the outer surface of this virus. Recently, or as we started doing some more investigations since the 80s, we've discovered that this is not a virus. And one of the reasons why they thought it was a virus is because when they were growing it in a lab, they needed to grow it inside of an embryo because it was an obligate intracellular parasite. And they didn't think that bacteria could have to live inside of a cell. So now we know it's a bacterium, small gram-negative bacterium. It has to replicate inside of a cell, so it kind of transfers between this RB and this EB. So the elementary body, or the EB, is small, super resistant to environmental stresses, and this is the infectious form. So this is the form that's going to bounce from one person to the next. When it gets inside of your cells and it infects the cells of your reproductive tract, it's going to convert itself into a reticulate body, an RB. And that RB is susceptible to antibiotics, but it's safe inside of your cells. So it's really tricky to find this, to be able to treat it while it's actually being transmitted, because the only one that's susceptible is the RB, which is hiding inside of the host cells, so it's hard to get to it. Sometimes they even convert into this PBs, and PBs are persistent bodies, and then the person is just a persistent carrier for chlamydia. So they'll have this inside of their cells for a really long time. They may even test negative for chlamydia, but it's still there, and they're transmitting it without ever knowing that they're transmitting it. Sexually transmitted and transmitted from mother to baby, and this is treated with antibiotics. So this is the most common reportable infectious disease in the United States, and a majority of the cases are in Milwaukee. So globally, Milwaukee has the highest number of cases in the world. That's like crazy. So Milwaukee, way to go. Majority of cases are asymptomatic. Symptoms in males include inflammation of the urethra, symptoms mimicking gonorrhea. Untreated infections may lead to epididymitis and, again, infertility. Symptoms in females, cervicitis, and may lead to pelvic inflammatory disease and infertility. So again, these symptoms are almost identical to gonorrhea. It's really based on diagnosis. So now with diagnosis of chlamydia and gonorrhea, it's all done through molecular tests. So nucleic acid amplification tests, or the NAT tests. And then we can tell you what organism it is, but they're both treated with the same thing. So it really doesn't matter, getting the diagnosis isn't too important. It's just for reporting the correct thing to the state, and that's key in getting the correct report to the state, because all of these are reportable. Certain strains can invade the lymphatic tissues, resulting in lymphogranuloma venereum, so you actually have swollen lymph nodes, particularly around the inguinal region or the groin. Headache, fever, muscle aches, the lymph nodes fill with granuloma tissue or cells and become enlarged and tender. Babies born to mothers with infections can develop eye infections and also pneumonia. So moving on to syphilis. Syphilis is caused by Treponema pallidum. So with the other ones, we had Gardnerella vaginalis. You kind of picture that one's the fishy vagina one. We had Neisseria gonorrhoeae, which causes gonorrhea. We had Chlamydia trachomatis, which is chlamydia. And now we have syphilis, which is Treponema pallidum. So the causative agent sounds nothing like the disease. So this is one of the ones that you're just going to have to tie together. There are 3 distinct stages to syphilis. There's primary, secondary, and tertiary syphilis. And after you get to tertiary, likely you will die from the syphilis. So there's latent periods of varying duration also occur between each one of the stages. This is transmissible during the primary and secondary stages and the early latency period between the secondary and tertiary, but once you're in tertiary syphilis, you are not contagious anymore. It's treated with antibiotics, but it can be fatal if left untreated. So with primary syphilis, you start with a canker. And the canker is at the site of the entry of the pathogen, and that's after an incubation period of 9 days to 3 months. That is a long incubation period. So you could have intercourse with an infected person and then 3 months later finally have your little ulcer. These cankers are usually small and they aren't painful, and if you don't notice it, it may go unnoticed. So if you're not getting routine syphilis tests and you are kind of doing risky sexual behavior, then I highly recommend that you start getting tested routinely for syphilis, because that canker is small and can go unnoticed. And if the canker is inside of the vagina, it's almost never noticed by the patient. Lymph nodes draining the affected region become enlarged and firm. A canker filled with spirochetes, and the canker heals spontaneously in 3 to 6 weeks, but by then the spirochetes have moved into circulation. And then there's a varying latency period here, but about 3 weeks to 6 months after that initial primary syphilis stage, then you have the skin rash. Now the skin rash is contagious. You can definitely spread the spirochete, but it's really obvious. So if you look at the picture of the skin rash, at this point you're going to go to the doctor. Like, you would be crazy not to. This rash is very obvious and it's all over the body. The spirochete is present in the skin. The loss of hair happens, you have malaise and a mild fever. But if you don't go to the doctor, you could progress to tertiary syphilis. Tertiary syphilis, after a latent period of up to 20 years, you have antibodies present, so you can test positive for syphilis this whole time. After a period of time, which can last up to 20 years again, you have this tertiary phase. This is really rare today because of the testing that we have, the diagnostic testing that we can tell if it's syphilis or not. But T-cell immunity, and it can affect the heart and liver, leading to death. And then you have these random ulcers that form. This is called a guma, and this is on the surface of the skin, but these ulcers tend to form on internal organs, including the liver and the brain. So the heart, liver, leading to death, but the brain lesions can cause people to go crazy. And in tertiary syphilis, a lot of times this is associated with severe paranoia and insomnia and crazy kind of sporadic outbursts, and there's really nothing you can do to correct tertiary syphilis at this point. This will progress to death. Congenital syphilis is when the baby is born with syphilis from the mom. Syphilis is a spirochete that can cross the placenta, so if the mom gets infected at any point during the pregnancy, they can give it to the baby. Causes stillbirths, snuffles. Snuffles sounds really cute, but snuffles is actually when the microorganism grows so much that scar tissue blocks the entire nasal cavity. It destroys the nasal cavity. Bunnies also get snuffles, and when my bunny got snuffles, I'm like, oh, that's so cute. My bunny died, so it's not a cute thing. They completely destroy the nasal cavity so that the animal, or the person in this case, cannot breathe. Hutchinson's teeth, so permanently they have these little indentations in their adult teeth. Herpes. So herpes is caused by the herpes simplex virus, and there's a lot of different herpes simplex viruses, but when we talk about herpes and the common herpes that we think about, HSV1 particularly infects the mouth and the face. That's the cold sores. About 90% of the world's population has herpes type 1. You get the blisters and they go away. These could be inside the mouth, outside the mouth, but they're blisters, and like I said, about 90% of people on Earth have this. HSV2, that one particularly infects the genital tract. So HSV2 is more associated with the genital herpes. Although these can be flip-flopped. It's not 100% of the time that the one is associated with the mouth and the two is associated with the genital tract. They can be vice versa. Symptoms vary per person. So usually, upon your initial infection, you'll have some vague flu-like symptoms, and then that may be accompanied by an outbreak of some blisters or some ulcers around the genitalia. The external genitalia will always have the eruptions in the exact same spot, and you can have varying periods of latency between eruptions. So one person can get infected and never have a symptom ever in their life, not even an initial outbreak. Another person can get infected and have regular outbreaks monthly. And it depends on the person's immune system and how often the virus replicates, and there's a lot of complicated things involved. But whether you have 0 outbreaks or 100 outbreaks in your life, you can transmit it to people at the same rate. Even if you don't know that you're infected and transmitting it, you can still transmit it. And how the virus is going to act in the new person can definitely be different from how it is in you. So if you think, oh, well, I have asymptomatic herpes, nobody's going to have symptomatic herpes from me. That's not true. It's all dependent on the person that ends up getting the virus. So there is latency where it hides out in the nerve ganglions. So those are the cell bodies of sensory neurons, and then it rides them up, kind of like with shingles when I talked about that. It will emerge on the surface, usually in the same exact spot on the external genitalia every time that you have an outbreak. But even without an outbreak, you are still shedding this virus at unknown intervals. So at any point, if you're infected, you can shed this for the rest of your life. In the neonate, it affects the brain and internal organs, and the baby is going to have lifelong disabilities if they survive. Acyclovir, which is also called Valtrex, is given to prevent this virus from replicating. Preventing it from replicating will decrease the likelihood that you're going to transmit it and will decrease the frequency of outbreaks. So usually Valtrex is only prescribed for patients that have regular and persistent outbreaks. And then we have human papillomavirus. So we talked about this a little bit previously, but there's over 100 known types of human papillomaviruses. Over 40 of these affect the anogenital region. HPV 16, 18, 31, 33, 35, and others are associated with cervical cancer, and type 6 and 11 cause genital warts. Of the ones that cause cervical cancer, they can also cause anal and oral esophageal cancer. So any type of sexual activity and direct sexual contact between the affected cervix, the anus, and the throat can transmit this and cause cancer in all locations in the body. So a woman who does have the cancer-causing form of HPV is at high risk of developing oral esophageal cancer later on in life, caused by the HPV that is on that woman's own cervix. This hides in the basement layers of the keratinocytes, so the bottom layers of your skin cells. And with the genital warts, when you want to remove a wart, you have to actually remove all the way down through all of the layers of the skin in order to successfully treat a wart infection. So you have to burn deep into the skin. And there's different methods of removing the wart, but with the cancer, again, you have to cut out and remove all of the layers of the skin in the infected area. So here's normal, here's low grade where you start to see some abnormal tissue on the surface, here's high grade, and then this is full-blown cancer where you can definitely see that it's an affected area and it has to be removed. The good thing about cervical cancer is very slow progressing, and only a very small handful of cases will progress to a full-blown stage 1 cancer. And from stage 1, an even smaller percentage actually progresses to stage 2. And these are all staged based on lymph node involvement and metastasis to neighboring tissues or metastasis to other organs, the lymph nodes, other parts of the body in general. So if you get your regular pap smears and you get tested for this, usually you can get it completely cut out of the body and not have to worry about it later on in life. But if you never go to the doctor, over a period of 10 years, you could definitely develop cervical cancer, and it could be an invasive type, higher grade cancer that could be dangerous. There is a Gardasil vaccine. There's a couple other vaccines that are being considered to be added to the market. Gardasil vaccine, we talked a little bit about the controversy of that with the vaccine debate. If you happen to miss the debate, or if you're in a blended class of this section with the Gardasil vaccine, it is controversial because of how fast it hit the market and the age that it's given. So between 12 to 22 years of age, after you're 22 years old, they don't recommend you getting the vaccine because they assume that you've already been exposed. But if you get it at age 12, the vaccine usually only lasts for about 8 years or provides protection for 8 years. So at age 20 is when the protection ends, and they don't recommend that you get another vaccine. So it's just kind of weird how those rules are in place and so forth. So most people are still sexually active after age 20, or may initially become sexually active after age 20, and that vaccine would no longer protect them. The other thing I want to mention about HPV is with the cervical cancer, it may not be too huge of an issue, although the incidence is really high now. The oral esophageal cancer and anal cancer, particularly in homosexual men, is alarming, and those are very dangerous types of cancer that are rapidly progressive and very serious. So although the cervical cancer one has the most awareness, these other types of cancers, particularly in the homosexual male population, this is something to make note of and be aware of.